Hi, this video is intended to get you ready for your upcoming breast surgery. So remember, you need to stop blood thinners 2 weeks prior to surgery. Most commonly, that is going to be aspirin, ibuprofen, fish oil, and vitamin E. You also need to stop any untested herbal supplements that, say if you're taking something for your metabolism, 2 weeks prior, because we don't know how those are going to interact with anesthesia. Now, you will need a ride home from the hospital and someone to stay with you the night of your surgery. So make sure you've planned for that well in advance and have things that you might need in your house so you don't have to run any errands, you have enough food, and if you've got kids, you've got someone who can watch your kids for you so that you can just rest. The night before your surgery, you need to stop having solid foods 8 hours prior. Now, if your surgery is really late in the day, you may be able to have a really super early breakfast. But 8 hours prior to your surgery, you need to stop solid foods and what we call full liquids, things like milk and orange juice. But you can continue to have clear liquids, water, Gatorade, apple juice, Sprite, tea or black coffee up until 4 hours prior to surgery. So that is important, and it does make you feel better. So take advantage of being able to drink the clear liquids a little closer to surgery. You need to come to the hospital super squeaky clean. So use that soap we gave you in the office, the Hibiclens, and really wash your armpits, your chest, your belly button. Make sure that area is really clean and don't put any lotion on in those areas. Remember to bring your surgery bra with you because I need to take this back before you go back to the room. So please remember to have it sitting out for me. Now, when you arrive, you're going to get asked lots of questions. They're going to start your IV. And if you're of a certain age, they'll also get a urine sample so they can get a pregnancy test. They may also give you some medications, and through your IV, you will get your antibiotics prior to surgery. I'll see you in pre-op holding. I'll do some markings on your chest, and you'll also be able to talk to your anesthesiologist. Now, when you're done with surgery, you'll go to a recovery room, and I will call whoever you designate so they know you're safely out of surgery, and then the nurse in the recovery room will call them when you're ready to go home. So if you're having surgery with breast implants, you will be given like a little credit card that has your implant information on it. Please don't lose this. Please put it somewhere very, very safe because you may have to find it 5, 10, 15, 20 years down the line. That has important information to take advantage of the warranty, and also if you ever need any revisional surgery, you know what kind of implants you have in. That would be very helpful to a future surgeon if you need any other surgeries. Now, when you arrive, they're also going to put potentially a little spot Band-Aid behind your ear. That's called a scopolamine patch, and it helps with nausea. It does have some side effects, so we don't like to give it to people who are of a certain age because it can make you feel a little bit goofy. It can also make your mouth really dry, and it can make your vision sort of blurry. So those are typical side effects, and if they're really driving you crazy, just take it off. Take soap and water on a washcloth. Be sure to wash behind your ear, wash your hands, and take that little spot and put it in the trash somewhere where a pet can't get to it. Sometimes people accidentally wipe that medication in their eye, and that can cause your pupil to dilate, which can be alarming, but it's mostly just annoying. Now, if you're having surgery like a breast reduction or a mastopexy, you likely will go home with a drain. And this is a drain. It has a little squeezy bulb with a cap that goes just right here. And what you do is you take the cap, you squeeze it to empty into a little cup, and the little bloody fluid that's in there will go into that little cup, and you can measure how much has come out. You then squeeze all the air out so that you collapse it, and you put the cap back on. As it starts to expand again, it's pulling fluid down there. So we just need to know what you empty morning, noon, and night. Keep track of that. And most likely we'll be taking this out at your first follow-up appointment. There are some maybe implant rupture cases where it may stay in a little bit longer, but if you're just having breast implants or augmentation with lift, you likely will not need a drain. This is more for breast reductions and lift patients, or maybe some revision breast surgery patients. Now, for generally for everybody, it's okay for you to shower the next day. And we do recommend that you at least, by day 2, take a shower. Everything can get wet, but it probably feels better to have the water hit the backside and just run down the front. You'll find that out soon enough. If you have really great water pressure, it probably doesn't feel good hitting your chest. But everything can get wet. And then I would recommend after your shower that you put a cotton t-shirt on with sleeves and put that surgery bra on the outside of that cotton t-shirt. The prep that we use in surgery can get really itchy, and also sometimes that surgery bra can chafe your armpits a little bit. So it is nice to have that cotton next to your skin. The other thing that you will likely notice is how fat your stomach looks after breast surgery, and this is super, super common. When you have surgery, your body doesn't really like to hold core strength. So what happens is that your belly gets big, then you also get a little bit gassy, maybe a little constipated. Those kinds of things can make your tummy look really large, especially if you've had children, but I promise it will go away, and it goes away pretty quickly. Other things that you might notice is sometimes a little numbness in your fingers from some of the medication that I give, and that should wear off by the next day. And it's not uncommon to just look a little puffy everywhere and hold on to a few pounds of extra water weight. Now, after surgery, it's important to understand your restrictions. And for breast surgery, we like people to keep their elbows within about 6 inches of their side. So you're just moving your arms around here, but you can bring your hands up to your hair if you need to. We don't want you doing a lot of this or arms up like this, and we don't want you doing any excessive pushing, pulling, straining, anything like that. And that's important for a whole month after surgery. For some reason, at 3 weeks after surgery is when I have seen most of the bleeding complications, and it's typically from not following your instructions and being a little too active. That involves going back to the OR emergently, and it's very painful, and nobody really wants to do that. You can tell if you get a hematoma, which is bleeding after surgery, because you become extremely swollen and hard on that side, and then that's followed by a lot of bruising. So this is typically not a subtle finding. It is very alarming when that happens. So again, follow those instructions. For most people, that's going to be 4 weeks. For some surgeries, it may be a little bit longer, and we'll go over that with you at your pre-op appointment. Other things after surgery that you may need to really have set in your brain is what you do with your medications. So we have patients the morning of surgery take at a minimum the 2 Tylenol and a Dramamine, and you can also take 2 of your Celebrex tablets with a small sip of water. You can do that when you're leaving the house. Now, when you get to the hospital, they're going to give you the patch behind your ear and IV medications. When you leave the hospital, they'll also let your caretaker and you know the last time they gave you any narcotics or Valium so that you know when you can restart things. Now, what we've learned over time in taking care of patients is it's good to keep a baseline treatment of pain, and that's what we like using the Tylenol for. You can take 2 extra strength Tylenol 3 times a day. That does allow you to take 1 extra dose in there if you absolutely needed it, but it keeps you well below the toxic level of Tylenol. So 2 Tylenol 3 times a day, morning, noon, and night is great. We also oftentimes, and most often, will recommend a medication called Celebrex. Celebrex is like a designer ibuprofen drug. And what we like about it is it gives, 1 pill gives 24 hours of pain relief, but it doesn't increase bleeding like the other non-steroidals like ibuprofen. So we give you a loading dose of 2 before surgery, and then based on your age and the time of your surgery, we'll have you continue to take those once or twice a day as needed. If you're not having any pain, you can certainly stop it, but the combination of Tylenol and Celebrex really cuts down on pain so that people can take less narcotic and less Valium. So Valium or diazepam is a muscle relaxant. If we're going like under the muscle for breast implant surgery, that muscle is going to spasm a lot, and a lot of that is going to, go away in the first day or 2. But the Valium can help relax those muscles and relieve some pain. Then oxycodone is the most common pain reliever. That's a narcotic that we recommend. And you can take that when the pain has reached a level that it really is bothering you. I think we did a huge disservice to patients in past years and generations by telling them to stay ahead of the pain. And that's probably why we have such a problem with opioids. You take that opioid when you need it. And if you are taking either the oxycodone, some people want something a little weaker called tramadol, and some people want something a little stronger called Dilaudid, those don't have Tylenol in them. So you always want to take your Tylenol, Take your Celebrex if that's ordered for you as well. And then you just need to take that narcotic as needed. Now, narcotics make you sleepy, they make you nauseated, so it's important to take them with a little food in your stomach, and they can make you very constipated. And that's why we want that to really be your last line drug. So if you're taking the Tylenol, the Celebrex, and the Valium, you may never even need to take an oxycodone or a narcotic. But if you do, you can. And if you're having an extreme amount of pain, having a hard time getting a handle on it, it's okay if you take 2 of those. But we recommend that you get back down to 1 as soon as possible. Other things that you may need after surgery are an antacid, which is totally fine. And if you haven't had a BM by day 4, it's important to take a laxative. And really any of the laxatives are going to be okay. If you start getting itchy, which can be from the prep, it can be from the healing, and it can also potentially be from your narcotics that release histamine, just taking some a Benadryl or a Claritin or a Zyrtec may help with that. Now, if you get itching and a rash, that is most likely an allergic reaction, and it's important that you start those antihistamines like the Benadryl and Zyrtec right away and let our office know, because we'll want you to stop whatever medication could be causing that, because that rash can get pretty bad and it can last weeks, so we want to try to nip it in the bud as soon as possible. Your activities when you get home, remember those elbows are by the sides, hands don't come up higher than your head, no straining, no exercise, no cardio, no weightlifting for 4 weeks. You want to sleep on your back with the back elevated for 2 weeks. If you do start turning to your side because that's more comfortable for you, I recommend you do put a body pillow here so that you can wrap your arm around that and kind of keep from squishing things. When you come back for your follow-up appointment, when it's time, we will teach you, if you've got implants, how to massage them, what to look for, and at the second follow-up, which is usually a week after that one, we'll take the hypoallergenic tapes off your incisions and start you on scar care. So hopefully this is helpful. Any specific things to your surgery, we'll be sure to go over. You can reference this again later, and look forward to seeing you at your surgery day. Thanks very much.